Stroke doesn't always arrive with dramatic warning. In fact, for many people over 60, the body begins sending quiet signals, hours, days, or even weeks before a major stroke happens. The problem is that these signs are often mistaken for normal aging stress or simply having a bad day. Imagine waking up one morning and noticing that your hand feels a little clumsy. Maybe you drop your coffee mug. Struggle to button your shirt, or your speech seems just a bit off. It goes away after a few minutes, so you tell yourself, "I'm getting older. These things happen." But what if they don't? Some of the earliest warning signs of stroke are so subtle that many people ignore them until it's too late. And by then, the opportunity to prevent a life-changing event may already be slipping away. Today, we're going to explore 7 silent warning signs of stroke that every adult over 60 should know. These aren't meant to scare you. They're meant to help you recognize when your body might be asking for attention. Along the way, we'll also discuss why these signs happen, what you can do if you notice them, and when it's important to seek medical care. Be sure to stay until the end, because the final sign is one of the easiest to dismiss and one of the most commonly overlooked by both patients and their families. Let's begin with an important truth. Many people think a stroke always strikes without warning. They picture someone suddenly collapsing, unable to move or speak. While that certainly can happen, it's not the whole story. A stroke occurs when blood flow to part of the brain is interrupted. Brain cells depend on a constant supply of oxygen and nutrients carried by the blood. When that supply stops even for a short time, brain cells begin to struggle. If blood flow isn't restored quickly, those cells can become permanently damaged. Sometimes the interruption is complete and lasts long enough to cause lasting injury. That's what most people think of as a stroke. But in other cases, blood flow is blocked only briefly before returning on its own. This is called a transient ischemic attack, often shortened to TIA. Many people also call it a mini-stroke. Even though the symptoms may disappear within minutes or hours, a TIA should never be ignored. It is a medical emergency because it can be an early warning that a larger stroke may happen soon. According to established medical guidance, the risk of a major stroke is highest during the first hours and days after a TIA, making prompt medical evaluation extremely important. This is why paying attention to subtle symptoms matters so much. Our brains don't always shout when something is wrong. Sometimes they whisper. And the first whisper brings us to silent warning, sign number 1. A sudden episode of numbness or weakness on one side of the body. Notice the word sudden. As we age, it's common to experience aching joints, stiff muscles, or occasional fatigue. But those problems usually develop gradually. Stroke-related weakness is different. It often appears unexpectedly. Perhaps you're sitting at breakfast, and suddenly your coffee cup feels heavier than usual. One hand doesn't seem to grip as tightly. Maybe one leg feels strangely weak while walking across the living room. Some people describe it as if one side of their body simply isn't cooperating. The weakness may be mild. It may last only a few minutes, then it disappears. That's exactly why so many people ignore it. Consider someone named Robert, who's 71. One afternoon, he noticed that his right hand felt clumsy while gardening. He couldn't hold his pruning shears properly for about 10 minutes. After resting, everything seemed normal again. Robert assumed he had overworked his hand. A few days later, he suffered a much larger stroke. While this example is fictional, it reflects situations healthcare professionals commonly encounter. Temporary weakness can have several causes, and not every episode means a stroke. However, sudden weakness affecting one side of the body deserves immediate medical attention, because it may be a sign that blood flow to part of the brain has been interrupted. Many people hope the symptom will simply pass, Sometimes it does, but that doesn't mean the danger has passed. One practical tip is to pay attention to how suddenly the change occurred. Ask yourself, did this happen out of nowhere? Is only one arm or one leg affected? Does one side of my face feel different too? If the answer is yes, don't wait to see whether it improves. Seek emergency medical care right away. Acting quickly can make an enormous difference because some stroke treatments work best when given within a limited time after symptoms begin. And here's something else many people don't realize. The next warning sign doesn't involve weakness at all. In fact, many people think it's simply fatigue or poor sleep. Let's talk about that now. Silent warning. Sign number 2 is sudden confusion or trouble speaking. Most of us occasionally lose our train of thought. We forget where we left our reading glasses. We search for a familiar word during conversation. Those experiences become more common with age and are usually not emergencies. But stroke-related language problems feel very different. Imagine trying to say a simple sentence, yet the words come out jumbled, or perhaps someone is speaking clearly to you, but suddenly their words no longer make sense. You know they're talking. You hear every sound, yet it's almost as though your brain can't put the message together. Some people suddenly begin using incorrect words without realizing it. Others stop mid-sentence because they can't remember the simplest expression. Family members are often the first to notice. They may say, "You don't sound like yourself," or "What are you trying to say?" This happens because different parts of the brain are responsible for understanding language and producing speech. If blood flow is disrupted in those areas, communication can change almost instantly. These changes may last only a few minutes before disappearing. Again, that temporary improvement can create a false sense of security. Someone might think, "I'm fine now." But temporary speech problems may be one of the clearest warning signs that urgent medical evaluation is needed. There's another subtle clue that often accompanies speech changes. You may have difficulty following simple instructions that would normally be easy. For example, someone asks you to hand them the television remote, but your brain hesitates. Not because you didn't hear them, not because you're distracted, but because your mind suddenly struggles to process information that usually feels effortless. If you ever notice sudden confusion, difficulty speaking, or trouble understanding, others don't try to drive yourself to the hospital if you're alone. Call your local emergency medical services or have someone else seek emergency help immediately. Quick treatment can improve the chances of limiting brain injury and may reduce the risk of long-term disability. Now here's something surprising. The third warning sign often affects only one eye, causing many people to schedule an eye appointment instead of recognizing that the problem could actually begin in the brain. And that's where we'll continue next. The third silent warning sign is sudden changes in vision. This one catches many people off guard because they naturally assume the problem must be with their eyes. After all, vision changes become more common as we age. Reading glasses get stronger, cataracts develop, and many older adults live with conditions like glaucoma or age-related macular degeneration. But a stroke-related vision problem often feels very different. Instead of gradually noticing that small print is harder to read, the change happens suddenly. One moment, you're watching television. The next part of the screen seems to disappear. Maybe one eye becomes blurry for a few minutes. Perhaps it feels as though a curtain has briefly come down over part of your vision. Some people describe seeing double, while others notice that they keep bumping into objects on one side because they can't see them clearly. These symptoms may come and go, and that's exactly why they're so dangerous. Imagine Margaret, who is 74. One afternoon while reading a book, she noticed that the words on the left side of the page seemed to vanish. She blinked several times, cleaned her glasses, and even adjusted the lighting. Within 15 minutes, her vision returned to normal. She assumed it had been eye strain. The next morning, she experienced a major stroke. Again, this is a fictional example, but it reflects situations doctors regularly see. Many people don't realize that your eyes are only part of the visual system. The brain does the actual work of interpreting what your eyes see. If blood flow to the brain is interrupted, vision can suddenly change, even when the eyes themselves are perfectly healthy. This is why sudden vision loss, blurred vision, double vision, or losing part of your visual field should always be treated as a medical emergency. Don't wait until your next eye appointment. Don't assume it will happen only once. Fixed emergency medical care immediately. It's always better to learn that the cause was something less serious than to miss the opportunity to prevent a larger stroke. While we're talking about the senses, the next warning sign affects something most of us take for granted every single day: our ability to stay steady on our feet. And because balance naturally changes with age, this warning sign is often dismissed as just getting older. Let's take a closer look. Silent warning. Sign number 4 is sudden dizziness, loss of balance, or trouble walking. Most older adults know what it feels like to stand up too quickly and become a little lightheaded. That usually lasts only a few seconds before everything returns to normal. Stroke-related dizziness is different. People often describe it as feeling like the room is spinning, or as though they suddenly can't trust their own legs. Perhaps you're walking through your kitchen and unexpectedly drift toward one side. Maybe you feel unusually unsteady while climbing stairs, or you suddenly have trouble coordinating movements that normally require no thought at all. Some people even find themselves reaching for furniture or walls to avoid falling. This happens because certain parts of the brain control balance, coordination, and body position. If those areas don't receive enough blood, simple movements can quickly become difficult. Of course, dizziness has many possible causes. Inner ear problems, dehydration, medication, side effects, and low blood pressure can all make you feel unsteady. That's why context matters. If dizziness comes on suddenly, especially if it's accompanied by weakness, vision, changes, difficulty speaking, or numbness, it should never be ignored. A common mistake many seniors make is deciding to sleep it off. They think that after a nap they'll feel better, but if the cause is a stroke, every passing minute matters. Here's an important reminder. Doctors often use a simple message to help people recognize stroke symptoms quickly. It's called BE FAST. The letters stand for BIM, balance problems; E, eye or vision changes; F, face drooping; arm weakness; speech difficulty; time to call emergency services immediately. This simple checklist has helped many people recognize symptoms sooner and get medical care faster. It may even be worth sharing it with your spouse, children, grandchildren, or close friends. You never know when remembering those 6 letters could help save a life. Now, here's something many viewers may not expect. The next warning sign can easily be mistaken for a dental problem, tiredness, or even sleeping in an awkward position. Yet it is one of the classic symptoms doctors look for when evaluating someone for a possible stroke. Let's move on. Silent warning sign number 5 is sudden facial drooping or an uneven smile. Have you ever looked in the mirror and noticed that one side of your face doesn't seem to move the same way as the other? Maybe one corner of your mouth appears lower. Perhaps your smile suddenly looks uneven in a family photo. Or when drinking water, liquid dribbles from one side of your mouth without explanation. Some people first notice this while brushing their teeth. Others realize that food feels unusual while chewing. Family members often notice it before the person experiencing it does. Someone may casually say, "Smile for the picture." And that's when everyone realizes that one side of the face isn't responding normally. Why does this happen? The muscles in your face depend on signals traveling from your brain through nerves. If blood flow to the brain is interrupted, those signals may not reach the muscles properly, causing one side of the face to droop or feel weak. It's important to remember that facial drooping can have causes other than stroke. For example, some nerve conditions can also affect facial movement. But because a stroke is one of the most serious possibilities, sudden facial weakness should always be treated as an emergency until healthcare professionals determine the cause. One simple test that doctors often recommend is asking the person to smile. If one side of the smile doesn't move normally, or if the face appears uneven, that's an important warning sign, especially when combined with any of the symptoms we've already discussed. At this point, you may have noticed a pattern. Many stroke warning signs don't last very long. They may disappear completely before medical help arrives. That can create a dangerous illusion that everything is fine again. But temporary symptoms don't always mean temporary risk. In fact, they can be the body's final warning before something much more serious happens. And the next sign is especially tricky because many people dismiss it as a headache caused by stress, dehydration, or simply a busy day. Yet, in some situations, it deserves immediate attention. We'll talk about that next. The sixth silent warning sign is a sudden unusual headache. Now it's important to begin with an important point. Most headaches are not caused by a stroke. People develop headaches for many reasons. Stress, dehydration, poor sleep, sinus problems, eye strain, certain medications, and even skipping meals can all trigger head pain. But there is one type of headache that should never be ignored. It's a headache that comes on, suddenly feels very different from your usual headaches, or is accompanied by other stroke warning signs like weakness, numbness, trouble speaking, vision changes, or loss of balance. Many people describe it by saying things like, "I've never felt a headache like this before. It came out of nowhere. It was unlike anything I'd ever experienced." Sometimes the pain is severe. Sometimes it isn't. The key isn't always how intense it feels. The key is that it's sudden, unusual, and different from what's normal for you. Why can this happen? Different types of stroke affect the brain in different ways. Some strokes don't cause headaches at all. Others, particularly strokes involving bleeding in or around the brain, may trigger a sudden and severe headache. That's why healthcare professionals never rely on headache alone to diagnose a stroke. Instead, they look at the entire picture, including all the symptoms a person is experiencing. Imagine James, who is 69. One evening, while watching television, he developed a headache that seemed to appear within seconds. He also felt slightly dizzy and noticed that his wife kept asking him to repeat himself because his words sounded unusual. James almost decided to go to bed early. Fortunately, his wife insisted they call emergency services. Doctors later confirmed he was having a stroke, and because he received treatment quickly, the outcome was much better than it might have been otherwise. Again, this is a fictional example, but it reflects the importance of acting promptly when unusual symptoms appear together. One mistake many people make is trying to wait until morning. They hope that after a night's sleep, everything will return to normal. Unfortunately, strokes don't work on our schedule. The brain needs oxygen every minute. The longer blood flow is interrupted, the greater the chance of lasting damage. If a sudden unusual headache occurs, along with any of the warning signs we've discussed, it's safest to seek emergency medical care immediately rather than trying to manage it at home. Another point worth remembering is that older adults often take medications that can affect blood vessels or blood clotting. That doesn't mean those medicines are harmful. They are often life-saving when used correctly, but it does mean that new neurological symptoms deserve careful medical evaluation. Now we've covered weakness, speech problems, vision changes, balance issues, facial drooping, and unusual headaches, but the final warning sign may be the easiest one of all to dismiss. In fact, many people don't recognize it until someone close to them points it out. And by then, valuable time may already have been lost. Let's talk about silent warning, sign number 7. Sudden confusion, unusual behavior, or changes in thinking. Most of us expect a stroke to affect movement. We picture someone unable to raise an arm or speak clearly. But sometimes the earliest change happens in the way a person thinks, responds, or behaves. Imagine you're having dinner with your spouse. Halfway through the conversation, they begin answering questions that don't quite fit. They seem distracted. They repeat the same sentence several times. Perhaps they forget where they are, even though they're sitting in their own home, or they become unusually quiet when they're normally talkative. Family members often describe it by saying, "They just weren't themselves." That simple observation can be incredibly important. The brain controls much more than movement. It helps us make decisions, recognize familiar. People organize our thoughts, solve everyday problems, and respond appropriately during conversations. When blood flow to certain areas is interrupted, thinking itself can suddenly change. Someone may struggle to follow a simple recipe they've prepared hundreds of times. A retired accountant may suddenly have trouble adding basic numbers. A grandparent who never forgets birthdays may seem confused about what day it is. These changes aren't part of normal aging when they appear suddenly. Healthy aging tends to bring gradual changes over many years. Stroke symptoms usually appear abruptly. That's one of the biggest clues. If a person's thinking changes within minutes instead of months, it should always be taken seriously. It's also important not to assume that confusion is simply caused by getting older. While infections, medication side effects, dehydration, and other medical conditions can certainly cause confusion, in older adults, a stroke is one possibility that must be ruled out quickly because early treatment can make a significant difference. At this point, you may be wondering something very important. If I notice one of these signs, even if it disappears, what should I actually do? That's an excellent question. The first step is simple. Don't ignore it. Don't convince yourself that it's probably nothing. Don't wait to see if it comes back tomorrow. Instead, seek emergency medical care immediately. Even if the symptoms disappear after a few minutes, they may represent a transient ischemic attack, or TIA. A temporary interruption of blood flow to the brain. A TIA doesn't leave lasting symptoms by definition, but it can be a critical warning that the risk of major stroke is much higher in the near future. Healthcare professionals may recommend tests to look at the brain, blood vessels, heart, and other possible causes. They may also discuss treatments or lifestyle changes based on what they find. The important thing is giving them the opportunity to evaluate the situation while it still matters. Remember one simple phrase: time is brain. Every minute counts. Millions of brain cells can be affected when blood flow is interrupted. Acting quickly gives doctors the best chance to protect brain function and improve recovery. Fortunately, there is encouraging news. Many strokes are linked to risk factors that can be managed. While no one can eliminate risk completely healthy, daily habits can make a meaningful difference over time. In the final part of this video, we'll discuss practical ways to help lower stroke risk after 60 common mistakes many seniors unknowingly make and the everyday habits that support a healthier brain, heart, and blood vessels. We'll also recap the 7 silent warning signs so you leave feeling informed, prepared, and empowered, not frightened. The good news is that while not every stroke can be prevented, many of the major risk factors can be reduced. That's an empowering thought because it means the choices we make every day really do matter. You don't have to make dramatic changes overnight. In fact, some of the most effective habits are also the simplest. Small, consistent actions often have a greater impact than short bursts of extreme effort. Let's look at several practical ways to support your brain and blood vessels as you get older. The first is keeping your blood pressure under control. If doctors could point to one risk factor that deserves the most attention, high blood pressure would be near the top of the list. Many people call it the silent killer because it usually causes no symptoms while quietly placing extra strain on blood vessels throughout the body, including those that supply the brain. Over time, that extra pressure can damage the walls of blood vessels, making them more likely to become blocked or, in some cases, rupture. The challenge is that you can't feel high blood pressure. You can't judge it by how energetic you feel or whether you have a headache. The only reliable way to know is to have it measured. If your healthcare provider has recommended checking your blood pressure at home, make it part of your routine. Record the readings, bring them to your appointments, and talk with your provider if the numbers are consistently higher than your target range. For some people, lifestyle changes may help improve blood pressure. For others, medication is also needed. If you've been prescribed blood pressure medicine, don't stop taking it or change the dose without speaking to the healthcare professional who prescribed it. The next habit is staying physically active. Now, that doesn't mean you need to run marathons or spend hours in a gym. For most older adults, regular movement is far more important than intense exercise. A daily walk, gentle cycling, swimming, chair exercises, or light strength training can all contribute to better heart and blood vessel health. Physical activity helps support healthy blood pressure, improves circulation, assists with blood sugar control, and can even benefit mood and sleep. If you've been inactive for a while, don't feel discouraged. Every step counts. Even adding 5 or 10 minutes of movement to your day is a positive place to begin. If you have a medical condition or concerns about exercising safely, ask your healthcare provider what type of activity is appropriate for you. Another important area is nutrition. Many people wonder if there's one special food that prevents strokes. The honest answer is no. There isn't a single food that can guarantee protection. Instead, it's your overall eating pattern that matters most. A balanced diet rich in vegetables, fruits, whole grains, beans, nuts, and lean sources of protein provides nutrients that support heart and brain health. Healthy fats, such as those found in fish olive oil and certain nuts, may also be part of an overall heart-healthy eating plan. At the same time, many experts recommend limiting foods that are heavily processed or high in added sugars, saturated fat, and excessive sodium, especially for people with high blood pressure or heart disease. That doesn't mean you can never enjoy a favorite meal. Healthy eating isn't about perfection. It's about making better choices most of the time. Hydration is another simple habit that's often overlooked. As we age, our sense of thirst may become less reliable. Some older adults simply don't feel thirsty even when their bodies need fluids. While dehydration doesn't directly cause most strokes, it can contribute to dizziness, confusion, low blood pressure in some situations, and other health concerns. Unless your healthcare provider has advised you to limit fluids because of certain medical conditions, because of drinking water throughout the day, is generally a healthy habit. Now, let's talk about sleep. Many people underestimate how important sleep is for overall health. Poor sleep affects much more than energy levels. It can influence blood pressure, blood sugar regulation, mood, and cardiovascular health. One condition that's especially important is sleep apnea. This is a disorder in which breathing repeatedly stops and starts during sleep. Common signs include loud, snoring, gasping during the night, waking up, feeling unrefreshed, or feeling unusually sleepy during the day. Sleep apnea has been associated with an increased risk of stroke and other cardiovascular problems. If your partner notices these symptoms, or if you've been told you stop breathing while asleep, it's worth discussing with your healthcare provider. Treating sleep apnea may improve both quality of life and long-term health. Now let's discuss another major risk factor that often receives less attention than it deserves. Atrial fibrillation, often called AFib. This is an irregular heartbeat that becomes more common with age. Instead of beating in a smooth, coordinated rhythm, the upper chambers of the heart may quiver. When that happens, blood can sometimes pool inside the heart and form clots. If one of those clots travels to the brain, it can block blood flow and cause a stroke. Some people with atrial fibrillation notice a racing or fluttering heartbeat. Others feel tired or short of breath, but many people have no symptoms at all. That's why regular medical checkups remain so valuable, especially after age 60. If you're diagnosed with atrial fibrillation, your healthcare provider may recommend medications or other treatments to reduce the risk of stroke. Taking those medications exactly as prescribed is one of the most important things you can do. Now let's address a habit that many people struggle with: smoking. The good news is that smoking rates have declined over the years, but many older adults either still smoke or have smoked for decades. Smoking damages blood vessels, raises stroke risk, and affects nearly every organ in the body. The encouraging news is that the body begins to benefit after quitting even later in life. It's never too late to gain health benefits from stopping. If quitting has been difficult in the past, don't view that as failure. Many successful quitters needed several attempts before finding the approach that worked for them. Your healthcare provider can discuss medications, counseling, or other resources that may improve your chances of success. Alcohol deserves a brief mention as well. Some people believe that more alcohol automatically means better heart health because they've heard stories about red wine. The truth is much more complicated. Current medical guidance does not recommend starting to drink alcohol for health benefits. For people who already drink, moderation is important, and some individuals should avoid alcohol altogether based on their medical history or medications. If you're unsure what's appropriate for you, ask your healthcare provider. Now, here's a mistake that many people unknowingly make. They pay attention to only one risk factor. They might say, "My cholesterol is good, so I'm probably fine," or "I walk every day, so I don't need to worry." Stroke risk usually isn't determined by just one thing. It's often the combination of several factors: blood pressure, blood sugar, cholesterol, heart rhythm, physical activity, smoking, nutrition, age, family history, medical conditions. Each one contributes a small piece to the overall picture. That's why regular preventive care matters so much. Annual checkups, recommended screenings, and conversations with your healthcare provider can identify problems before they become emergencies. Prevention rarely feels dramatic. It often happens quietly, one healthy decision at a time, and that's exactly how many people protect their independence for years to come. In the final section, we'll quickly review the 7 silent warning signs we've discussed today. Talk about what to do if you ever notice them, and leave you with one simple message that could one day help save your life or the life of someone you love. Before we finish, let's bring everything together with a simple review. Today's goal wasn't to make you anxious. It was to help you recognize that a stroke doesn't always begin with someone collapsing or losing consciousness. Sometimes the earliest warnings are quiet. Sometimes they last only a few minutes. And sometimes they disappear completely before a major stroke occurs. That's exactly why recognizing these signs can be so important. Let's review the 7 silent warning signs one more time. The first was sudden weakness or numbness on one side of the body. If an arm suddenly feels weak, a leg becomes difficult to move, or one side of your face feels numb, don't assume it's simply because you're tired or getting older. Sudden changes deserve immediate medical attention. The second was difficulty speaking or understanding speech. If your words suddenly become slurred, you can't find simple words or other people's sentences, stop making sense, treat it as an emergency, even if the symptoms improve a few minutes later. The third warning sign was sudden vision changes. Blurred vision, double vision, losing vision in one eye, or missing part of your visual field may be signs that something serious is affecting the brain, not just the eyes. The fourth sign was sudden dizziness, loss of balance, or trouble walking. While dizziness has many possible causes, a sudden loss of coordination, especially when combined with other symptoms, should never be ignored. The fifth warning sign was facial drooping or an uneven smile. If one side of the face suddenly doesn't move normally, or a loved one's smile suddenly looks uneven, seek emergency medical care right away. The sixth warning sign was a sudden unusual headache that's different from your normal headaches, particularly if it's accompanied by other neurological symptoms such as weakness, confusion, or vision changes. And finally, the seventh sign was sudden confusion or changes in thinking and behavior. If someone suddenly seems disoriented, has trouble following simple conversations, behaves unusually, or just isn't acting like themselves, don't dismiss it as normal aging. When these symptoms appear suddenly, they deserve prompt medical evaluation. Now there's one message that I'd love for every viewer to remember after watching this video. Don't try to diagnose a stroke by yourself. You don't have to know exactly what's causing the symptoms before seeking help. If you notice possible warning signs, especially if they begin suddenly, the safest choice is to call your local emergency medical services immediately. Let trained healthcare professionals determine what's happening. It's always better to be evaluated and discover it wasn't a stroke than to stay home and lose valuable treatment time if it is. Remember the simple phrase we talked about earlier, B fast B, for balance problems, E for eyes, sudden vision changes, F for face drooping, A for arm weakness, S for speech difficulty. T for time to call emergency services. Those 6 letters are easy to remember, and one day they could help you recognize a stroke in yourself, your spouse, a friend, or even a complete stranger. It's also worth remembering that prevention doesn't happen only in hospitals. It happens in kitchens, on neighborhood walks, at routine medical appointments. When you take your medications as prescribed, when you choose healthier meals more often, when you keep moving even on days you don't feel especially motivated, when you monitor your blood pressure, when you ask questions instead of ignoring new symptoms, these small choices may not seem dramatic from one day to the next, but over months and years, they can make a meaningful difference to your health and your independence. Growing older doesn't automatically mean losing control of your future. While none of us can eliminate every health risk, we can stay informed. Pay attention to our bodies and work with our healthcare providers to make the best decisions possible. Knowledge is powerful, and acting on that knowledge is even more powerful. If today's video helped you understand stroke warning signs a little better, I hope you'll keep this information in mind, not because you expect something bad to happen, but because being prepared can make all the difference if an emergency ever occurs. You may even want to share this video with a spouse, family member, neighbor, or close friend. Many strokes are first recognized by someone nearby, not by the person experiencing them. A simple conversation today could one day help someone receive life-saving care sooner. Thank you so much for spending this time with me. Now I'd love to hear from you. How old are you, and which country are you watching from today? Have you or someone you know ever recognized one of these warning signs and sought medical care? And which of the 7 silent signs surprised you the most? Your experiences may encourage or educate someone else reading the comments, and together we can build a community that helps one another stay healthier, safer, and more informed as we age. If you found this video helpful, consider subscribing for more evidence-based videos on healthy aging brain, health heart, health nutrition mobility, and practical ways to support your well-being after 60. Until next time, take good care of yourself, keep listening to your body, and remember, when it comes to stroke, acting quickly can make all the difference.